So my name is Paulina Tessler. In my adult life, I'm a psychiatrist at the Brigham. I don't have any organizational experience or NGO experience, but what we've been doing is just directly trying to figure out what they need, like daily communication of like, what do you need today? And, it started with, we need tourniquets and IV poles and IV bags, and then insulin. And then more recently, they've been asking for things like portable ventilators.
As we know from the people who work there, who've been there, like all the medical supplies from the hospital in Irpin are taken back to Russia. They stole everything. Even like the ambulances.
And needs are increasing every day.
Local government cannot keep up with all of this.
What's next here that we have to be thinking about as healthcare workers here that want to be supportive to all of your efforts here?
Well, I think the most pressing need is trauma care, and for both children and adult, and that's not going to go away until the war ends. Chronic conditions are not going away. Patients require insulin. Cancer patients require to be treated. So lots of complex issues.
At this particular time, what are the things you're looking for help here?
What's really is probably will be a huge need right now is definitely we are lacking lots even of basic medications, even when we're talking about this chemotherapy drugs. We definitely simplified our chemotherapy regimens to basics, but even though we still have a lack of basic routine chemotherapy agents.
I'm myself a surgeon, cardiothoracic surgeon, as many of you know, and Nelly and I, we are both Ukrainians, so we felt like something needed to be done. So here, this is me crossing the border, and basically this is the surgical supplies and instruments in those duffel bags, and you just have to walk across the border. But a lot of the need is in education. That's a picture of their operating room, very basic, very outdated. They need a lot of help. Civilian population, military hospitals get right now more supplies, but civilian hospitals also need a lot of help. And I brought some surgical instruments, and they were the first American instruments in the history of that hospitals. And it's one of the biggest hospital in the Rivne region, which is one of the oblasts. So they're just totally behind on certain supplies. Lindsay and Skidder donated this butterfly ultrasound, which is also a huge deal for the portable ultrasound for the trauma care. That's in Boyarka, brought some supplies to the surgeon. That specific surgeon, when they had a trauma patient with a shrapnel wound to the abdomen and multiple injuries to the small bowel, he didn't have a stapler, and those staplers that they brought were actually the first ones that they got, and so he had to sew it by hand, and he didn't even have a long suture to do it, what we call it a Connell stitch, to do it a little faster. So he had to do it with just his basic sutures that he had. So even though biggest need is in the east and in the south, all the biggest cities of Ukraine, just civilian hospitals, regional hospitals, they're well behind supplies. So obviously some chest tubes and suture materials and wound materials. But the point is that they need help. They have very good surgeons. They're very, very, very educated. I think the need is of a very directed help. What surgeons need, and then to give that to them.
My father, he's a doctor, he's a physician, retired at this moment, but he actually helped me to understand what exactly is the key points, how to find the best way to help, and basically to address locally, not globally, but more locally, hospitals across the country and understand their particular needs in supplies and medications even. And since I joined the group, I started also just to make some connections across the people we can trust. And if I may, I'll just share one slide. It's quite important. And so far, I've got lucky to reach to the physicians in Kharkiv and in Odessa, those people which are really can speak about the particular needs. And we've got a list of the supplies that they provided that we'll try to collect and send.
Thanks to all the participants. I think we've heard the real broad scope of what is needed, what are the needs there that really vary from specific healthcare equipment all the way to education. It's great to hear all the way down to biology education for high school students. My mantra is to repair, rebuild, and restore even during a time of war. And I think that's what the mission of HUG is to help network those people who want to do that together and connect to people like Dr. Spigovsky in Ukraine to make sure we deliver what is actually needed in Ukraine, like in a timely manner. Same for Sergey, eyes on the ground, seeing what the operating rooms need. It's like incredibly valuable. We hope to, we're in this for the long run. We're in this sort of webinar type setting for the long run. We've got the next one planned in 2 to 3 weeks' time, and we'll continue that. until the need is no longer there for us to be doing this.